Hi friends, today we're going to talk about implants, a little bit about nails and external fixators, right? So it's a very vast topic. I'm just going to do very briefly so that this helps you in your exam. It's not going to be a comprehensive thing about nails, right? So nails are, we discussed this in about plates. Plates are load sharing device, whereas nails are load bearing device. So nails can bear weight along with the bone, whereas plates only share load. And therefore, what is the important thing here is that the plate will tend to fail much faster, right? If the bone does not unite, it will fail much faster, whereas the nails will tend to last longer and give the bones a little more support in a longer period of time. So this is the important difference between nails and plates. Nails are load bearing, they bear weight, whereas plates only share weight. So this is a very important concept. Nails. Now, some of the structural properties. What is torsional and bending rigidity? Torsional rigidity is defined as amount of torque required to produce torsional or rotational deformity. Torsional is the same as rotational deformity, the amount of torque required to do the rotational deformity. So torsional rigidity is directly proportional to the fourth power of the radius of the nail. It's a solid nail. If it is a solid nail, it is the fourth power of the radius. It is directly proportional to the third power of the hollow nail, right? Next, coming to the bending rigidity. Bending rigidity is also again the force required for the nail to bend. It is also directly proportional to the fourth power of a solid nail, the radius of a solid nail. And in case of a hollow nail, again it is directly proportional to the third power of the third power of the radius of the hollow nail, right? So next, coming to the material of the nails, it can be either titanium or steel. Most of these are stainless steel, medical grade stainless steel. Very few of the nails are made of titanium, like the Ender's nail and similar nails, condylocephalic nails can be made of titanium, but most of the nails are made of stainless steel type of a variety of stainless steel. Right? What is the radius of curvature? Radius of curvature is usually greater. We all know that there is a small radius of curvature for the femur nail. It is usually greater than the actual curvature of the femur. So this is the radius of curvature. It is present in most of these femur nails, and it is a little variate. There's a lot of variation in different types of nails as well. Now coming to the biomechanical properties of the nails. So one is called as a cross-sectional area. The greater the cross-sectional area, the stronger it is. The greater the cross-sectional area, the stronger it is. Now we have a concept of what is called as the so we have a concept of the length of the nail and the length on the concept of working length. So the length of the nail is the total length of the nail which is put in the bone. Total length of the nail which is put in the bone is called as a working length. So this is the working length, right? The length between where the nail comes in contact with the cortex is called as a working length. Nail comes in contact with the is also called as a working length. And this is so true in case of reamed nails. Now if you put screws, one above and one below, right, locking screws one above and one below, that becomes your working length in cases of where you have put a screw. So where there is a simple nail like a K nail or a generation 1 nail, you have the working length which is where the nail is in contact with the bone on either side is called as a working length. If you've locked the nail, then it is in the between the two locking screws is the working length of the nail. So this is the concept of working length, which is very important, and we already discussed the diameter curves. The femoral nail is slightly curved. Usually the diameter or the radius of curvature is more as compared to the normal diameter of the femur. So we have three types of nails, with centromedullary nail, which includes the first generation nails like K nails and nails which pass through the center of the canal, all through the canal, for example K nails, V nails, and some of the medullary interlocking nails. And the second, we have cephalomedullary nails like the PFN, which usually we put in a locking screw to fix to the proximal end or distal end of the long bones is called as a is called the cephalomedullary nail. Then you have the condylocephalic nail, which passes through the condyles, for example like the Ender's nails, Ten's nails. So these are some of the examples which multiple nails are passed from the condyle into the medullary canal, and these are called as the condylocephalic nails, right? So what are the advantages of nails? The advantages of nails are that you can do indirect fracture reduction, so you don't have to open the fracture site. So the fracture hematoma is intact, and therefore the constituents required for fracture union are not disturbed. Number two, we can do in small surgery in small incisions. We don't have to make large incisions to fix the site. And unlike plates, these are load sharing devices, right? So load sharing devices, and therefore they share the load along with the, forgive me, cut. So these are load bearing devices, and therefore they, I think I made a mistake in the first slide. So these are load bearing devices. They bear load along with the bone, and therefore they take a much longer time for the fracture to unite. So early weight bearing can be started. Early weight bearing can be started. There is some micromotion at the fracture site, and therefore there is some micromotion at the fracture site. This aids in fracture union by secondary intention. That is, there is some callus formation, as we all know. So it produces relative stability. Relative stability produces strain of 2 to 10%, and therefore you can have callus formation and fracture union occurs. So these are some of the advantages of nails. What are the advantages? One is indirect fracture reduction. We don't disturb the fracture hematoma. We do the surgery in small incisions. It's a load bearing device, and therefore bears load and fails later than plates and other devices. Early weight bearing can be done. Micromotion helps in the fracture union. So these are some of the advantages of using a nail. Okay, so nails can be used in two different mechanisms. You can use in static and dynamic fashions. In static fashion, it is fixed and there is no micromotion of the nail of the fracture site, and therefore it has to heal by primary intention. Whereas dynamic is, there is some movement in the fracture site, and as the patient bears weight, there is a motion between the two fracture ends, and callus formation and healing via secondary intention can happen. We can dynamize the nail later on. That is, you make a static into a dynamic system when you see there is no signs of union. So to cause micromotion at the fracture site, you can convert a static to a dynamic fracture fixation. There's also a concept of polar screws. I'm sure all of you know this very well, but we'll briefly go over it. So you use screws to avoid the nail going in the direction you want. For example, if you want to avoid a varus collapse of the tibia, then you put the screw on the side that you don't want it to go into varus, and then when you pass the nail, it avoids that area and it goes straight. So these polar screws are usually used for tibial nailing. They're used for very proximal fractures or very distal fractures to centralize the nail. So these are called as polar screws, and this is one of the uses of the screws that we discussed in the screw section. So polar screws are commonly asked question. You should be able to answer. The trick to answering this question is that the screw must be placed where you don't want the nail to go in. So where you don't want the nail to go, that is where you have to insert the nail to go. That is where you have to insert the polar screw. Now reaming of the bones for nails, right? There's a lot of controversy whether you have to ream or not ream. So reaming causes the following things. What does reaming do? It increases the working length. It increases where the contact increases the working length of the nail, because there's a larger area of contact. Okay, when you ream and when you put the nail in, there's a larger and tighter contact of the nail with the bone, and therefore there increases the working length. It increases the blood flow at the fracture site. And although the centrifugal or the endosteal blood supply is obliterated, the periosteal blood supply is stimulated. And overall increases the vascularity of the fractures at the fracture site. It provides bone graft, so there are pieces of bone which remain there and heals faster with reaming of nails. What are the disadvantages of reaming of nails? It causes thermal necrosis and can cause death of tissue there. It can cause fat intravasation and can cause fat embolism at the time of reaming. So the anesthetist must take care of this and make sure that there are no such issues with the same thing. Okay. Next, coming briefly to external fixators. So external fixators are used in the following conditions. All of us know this. It is a temporary stabilization, which is used in case of polytrauma when we cannot do definitive fixation, damage control orthopedics, which will be discussed in another video. Right. We can also do it as a definitive fixation in certain conditions where we use Ilizarov fixators, ring fixators. There are certain fractures which can be used only an Ilizarov fixator can be used. It is used in case of infection. It is used in case of very severe soft tissue damage, because it will preclude a definitive fixation with a plate or nail. In these cases, we use external fixator, and over a period of time, these are changed to first after plastic surgery and reconstructive methods, they can be changed to internal fixation. The second, some of the uses are certain fractures like distal and radius, or some just fixators. We can use temporary. We can use this as a definitive method of fixation in these kind of fractures, right? So now, what are the factors that increase stability of the external fixator? Very important, very commonly asked. The contact ends of the fracture has to be in good contact with each other. It should not be a poor reduction, so we have to reduce the fracture very well. You have to have larger diameter pins. The more diameter pins, the more stability of the external fixator. This is the single most important factor. Important factor is the diameter of the pins. The more number of pins that you use, the more number of pins that you use, the more stable the external fixator. You have to decrease the distance of the rod from the rod to the bone. So it is a connecting rod. Distance has to be reduced from as much as possible from the bone, which will increase the stability. Pins are placed in different planes, uniplane or biplane, multiple planes. If you use pins and do it, it will cause improvement in this thing. So pins in different planes can be used. We can increase the number of rods. So we can increase, if you increase the number of connecting rods to 2, then that also increases stability of the external fixator. Connecting rods in different planes increases the stability. Increasing spacing between the pins. It is good to have a pin as close to the fracture site as well, but the other pins, if they are spaced out, it increases stability of the external fixator. So these are some of the factors that play a role in increasing the stability of the external fixator. So we all know the Ilizarov ring fixator. This is a huge topic on its own, but just a few things about the Ilizarov ring fixator, because it comes, we are discussing about implants. How do you increase stability of the Ilizarov ring fixator? Larger diameter wires must be used as usual. So this is a single most important factor in both in external fixator and Ilizarov ring fixator. The one thing that increases stability is a larger diameter wires, olive wires, multiple wires can be used. Decreasing the ring diameter, the closer to it, the bone it is, the more stable it is. Increasing the wire diameter, which has already been described. Increase tension in the wire as much as possible, which will increase stability. More number of rings, and placing rings close to the fracture site. So these are some of the factors that will increase the stability of the Ilizarov ring fixator. So this is in very brief about nails, external fixators and Ilizarov ring fixators. It's a huge topic in itself, but I hope this helps you to write the questions in the exam. Thank you very much.